Let's start today the another topic of MRI. The full form is magnetic resonance imaging. What is MRI? Magnetic resonance imaging is a test that uses powerful magnets, radio wave and a computer to make detailed picture of the inside of your body. Your doctor can use this test to diagnose you or to see how well you have responded to treatment. Unlike X-ray and computed tomography scans, MRI don't use the damaging ionizing radiation of X-rays. What kind of equipment is used in MRI? Let's discuss it. A typical MRI machine is a large tube with a hole at both ends. A magnet surrounds the tube. You lie on the table that slide all the way into the tube. In a short bore system, you are not totally inside the MRI machine. Only the part of your body that is being scanned is inside. The rest of your body is outside the machine. An open MRI is open on all the sides. This type of machine may be best if you have claustrophobia, a fear of tight spaces, or you are very overweight. The quality of images from some open MRI machines is not as good as it is with a closed MRI. Why MRI is done for and why we need this MRI test. An MRI helps a doctor diagnose a disease or injury, and it can monitor how well you are doing with a treatment. MRI can be done on different parts of your body. It's especially useful for looking at soft tissues and the nervous system. An MRI of the brain and the spinal cord can help find many things, include blood vessel damage, weakened blood vessels in the brain injury, cancer, stroke, eye problems, inner ear problems, multiple sclerosis, spinal cord injuries. An MRI of the heart and the blood vessels looks for the blocked blood vessels, damage caused by a heart attack, heart disease, pericarditis. This is the inflammation of the tissues that surround the heart. Problems with the aorta, the main artery in the body. Problems with the structure of the heart. An MRI of the bones and the joints looks for the arthritis, bone infection, cancer including tumor, damage to joints, disc problems in the spine, neck or the low back pain with nerve signs. MRI can also be done to check the health of these organs, including screen for breast cancer in the people who have high risk for developing the disease, see how large a tumor is and how far it has spread in the people who have been diagnosed with breast cancer, find out whether the cancer has come back after it has been treated with surgery or chemotherapy, see whether the woman's implants have ruptured, liver, kidneys, ovaries in women, pancreas and prostate in men. Also discuss a special kind of MRI called a functional MRI. So you can also see this thing. So here is the information for you. fMRI maps brain activity. This test looks at the blood flow in your brain to see which areas become active when you do certain tasks. An fMRI can detect brain problems such as the effects of a stroke, analyzers or a brain injury. It can also be used for brain mapping If you need brain surgery for epilepsy or tumors, your doctor can use this test to plan your treatment. How do I get my MRI result, or how do you get your MRI result? A specially trained doctor called a radiologist will read the result of your MRI and then send the report to your doctor, and your doctor will explain or examine the meaning of your test result and what to do next. He will tell you. What are the side effects of MRI, or what are the major risk factors from MRI? Pregnant women should not get an MRI during their first trimester unless they absolutely need the test. The first trimester is when the baby's organs develop. You also should not get contrast dye when you are pregnant. So don't get contrast dye if you have had an allergic reaction to it in the past, or you have severe kidney disease. Certain people with metal inside their body can't get this test, including those with some clips used to treat brain aneurysm, pacemaker and cardiac defibrillators, cochlear implants, certain metal coils placed in the blood vessels. Thank you very much for watching the videos.